Now, let's take a look at the most common comorbid disorder to occur with ADHD, and that is oppositional defiant disorder. Studies indicate that anywhere from 40 to 80% or more of ADHD children are likely to show this pattern of hostile, angry, defiant behavior, stubbornness, refusal to obey. So it turns out to be the most common comorbidity. Excuse me. And there is a good reason for that. It now appears that ADHD is likely to have caused this comorbidity, at least to some degree. Let me explain. Contrary to what you see in DSM-4, oppositional defiant disorder is not a single dimension. It is actually a dual dimension disorder. There are two separate factors of symptoms that contribute to making up this disorder. One set of factors or items are symptoms that refer to emotion and emotion regulation. And these, of course, would be things like low frustration tolerance, quickness to anger, temper outbursts, proneness to hostility. So there is a mood component to oppositional defiant disorder. Now, distinct from that mood component is the second dimension, which is that of social conflict. This is the arguing, the defiance, the refusal to obey. And that involves interaction with another individual and conflict in that interaction. Research now indicates that these are two separate dimensions that contribute independently to risk for ODD. One of them arises as a result of having a disorder like ADHD or a mood disorder, and it appears to be intrinsic to the individual, and that is the mood component. The second component, which is the social conflict component, appears to largely be learned, and we'll talk more about that briefly. So there is a two-dimensional composition to oppositional defiant disorder. And that explains, by the way, why ODD is 11 times more likely to arise in cases of ADHD and to arise within 2 years of the onset of ADHD symptoms. And that is because the ADHD is contributing to the mood component of ODD.